Good afternoon and welcome to the first Care Partner presentation at Insight Memory Care Center for 2025. Today, we'll be talking about the Social Security disability benefits for early onset dementia diagnosis. And our presenter today is Sharon Napper. Our mission here at Insight is to provide specialized care, support, and education for individuals in all stages of memory or cognitive impairment, their partners, and the community. Our vision, a community where those living with memory or cognitive impairment and their care partners achieve the highest quality of life. We're a leader in dementia care in Northern Virginia. Proud to say we had our 40th anniversary last year. We care with specialized adult day programs for people in all stages of dementia journey. We connect by building relationships and supporting care partners on their journey. And with creativity, our dementia experts are sharing their knowledge and resources because every journey is unique. Sharon Napper is a certified dementia practitioner and professional trainer, Alzheimer's Association for the Greater Richmond chapter. She has been a resident of Virginia since 1999. She has served her community as a special education teacher assistant, pediatric nurse, cardiac acute care nurse, and orthopedic step-down nurse, and a medical surgical clinical nurse for 16 years in the Central Virginia area. She has seen the need for more education and outreach in the community, dealing with our great struggles with food deserts, high blood pressure, diabetes, and Alzheimer's, and as a whole healthcare inequity in the Commonwealth of Virginia. She's a certified dementia practitioner and a professional trainer for the state with the Greater Richmond chapter of Alzheimer's Association. Welcome, Sharon. And just for some housekeeping rules, we are recording. Please put any questions in the Q&A, and we will go ahead and let Sharon get started.
Good afternoon, everybody, and I'm glad everybody has been safe throughout this wonderful weather that we've had and enjoying some time to just enjoy nature. I thank you so much, Melissa, for that wonderful introduction. I am a nurse by trade, but one thing I saw in healthcare early on is that there needs to be more community education about a lot of health issues, and especially with most of the risk factors of diabetes and eating healthy and high blood pressure and all of those things contributing to contributing to dementia. I think it's very important that we educate people on actually what it is and what we need to do in regards to dementia. Now, today's conversation is early onset dementia and compassionate care allowance. Years ago, before basically about 1998, 2000 or so, you still had to wait for your disability, Social Security to kick in at a certain age. And with the way that times have changing and people are advocating for change for healthcare supports, not just for the person with can everybody still see my screen?
It is black right now.
Okay, yeah, because I was looking at something and I changed. Okay. Are we back now?
You're back. You're good.
Okay. So at the Alzheimer's Association, we are the leading voluntary health organization in Alzheimer's care, support, and research. Our mission is to eliminate Alzheimer's disease through the advancement of research and to provide the enhanced care and support for all affected, not just the person with dementia, but also their families, and to reduce the risk of dementia through the promotion of brain health, nutrition, explaining how we can reduce our risks, understanding it so that everybody understands. And you're not sitting there like some people are when we go to their doctor and our doctor's telling us stuff and like, well, what does that really mean? And our vision, of course, is a world without Alzheimer's disease. So when we talk about early onset dementia, Alzheimer's disease is usually the most common form of dementia, and that's for many different reasons based on what was approved by insurances a long time ago to what now people have access with healthcare. But what we do know is that it affects your memory, thinking, and behavior, and it is often progresses to the point where it affects daily activities and functions. Alzheimer's disease does not commonly affect only affects older adults. And so when we think about Alzheimer's, we think that, as some people say, an old person's disease, 65, 70. But it can also affect people in their 30s and 40s. When Alzheimer's happens to someone younger than 65, it's called an early onset or younger onset Alzheimer's disease. A very small number of people with Alzheimer's disease have the early onset form. Many of them are in 40s and 50s when the disease takes hold. So when we think about early onset dementia, we're going to talk about things that can contribute it to you getting early onset dementia, be it health conditions, other things that have happened in your life. And it also can be genetic. Nobody ever plans for this. Nobody ever thinks that it's actually happening. And what we've found out through research is that we truly believe in the state of Virginia, there's about 44% of Virginians that believe they have some type of cognitive decline going on in their 40s and 50s. They don't report it to their doctor. They don't really talk about it, but they can tell there's a change. So, what we are doing now as a Commonwealth and as a healthcare initiative is getting out into the earlier ages, because we know that those physiological and biological changes start in your 20s and 30s when you're out, probably not doing the best that you need for your healthcare. You're out kind of partying, you're doing not a lot of sleep, you're not resting good, you're not eating right. So, we're trying to go back in the high schools and the colleges and educate them about the risks so that they can plan for their lifelong plan, and not just when they get in middle age, or not just when they get older in their 50s or 60s. So we have to realize that this is not just a thing or a disease that affects older people, it can affect younger adults also. Now, diagnosing early onset, healthcare providers generally do not look for Alzheimer's disease in younger people. And getting that accurate diagnosis of early onset Alzheimer's is a very frustrating process. Symptoms may be incorrectly attributed to stress, or they may be conflicting or contributing diagnoses from different healthcare professionals. And within that statement, that means that this person could have had uncontrolled hypertension, high blood pressure for their teenage years, their younger years, and they finally got a hold of it maybe in their 40s or 50s. But guess what? That vascular system has seen damage. Maybe they had not controlled their cholesterol. Maybe they've had a problem with snoring and obesity, and they have not had their CPAP to make sure that air is getting to us. The average person that needs a sleep apnea machine stops breathing anywhere from 5 to 9 times a night. Now, if you take that and multiply that over years, you will realize how much oxygen is depleted from your brain. So when you're looking at someone that might be younger, and you're looking at, well, how could they have early onset Alzheimer's? But if you look at their medical history, you're looking at all the information from their cardiologist, their primary care physician, their endocrinologist, and you're looking at all the data, and you're looking at seeing what has affected this person to the point they came into your care. You realize that there's a real possibility that that could have happened. And that's not even looking at genetics. And then people with early onset may have any stage of the dementia, early, middle, late, because it affects each person differently and the symptoms will vary. So by the time the person really says, you know what, I'm something's missing. My routine is not my routine anymore. I'm forgetting things, doctor's appointments, taking the dog to the vet, or I'm not remembering to go and pay these bills. There's things that they're starting to realize. So we have to realize that even though the person might be in their 40s and 50s, it is very important that we are looking at the total picture. We are documenting, we're taking notes ourselves. So, primary dementias, such as Alzheimer's disease, may be also part of that early dementia, early onset, frontal temporal, and vascular dementias, which is where the high blood pressure issue comes in. Genetic and familiar dementias, metabolic disorders, secondary dementias, such as those that result from alcohol use disorder, traumatic brain injuries, infections. Young onset dementia, the presentation is varied and it includes cognitive, psychiatric, and neurological symptoms. You have to get assessments that are needed. And by that, that means an accurate diagnosis. You have to make sure that you advocate for your health. You advocate with the different doctors and resources and referrals, or have someone in your family that's a strong advocator for those screenings that are recommended, like that full health history, the access to neuroimaging, lumbar punctures, because they can take spinal fluid and look at that, neuropsychology evaluations. That usually takes someone asking a series of questions, also being on a computer, and then usually they will have a close family member or friend answer some questions to get a true neuropsychology look at the person. And of course, genetic testing. And when I say that all these things are needed, again, the reason why it's important that you're advocating, you're getting the information, you're getting your paperwork. As we go through this presentation, it's very important that you keep up with all of this stuff. You understand that you need to have it printed out. You make sure, if your doctor is not aware that you are, maybe still working, or you have some questions, you're trying to get that Social Security disability. You need to have all of those things together. And I say a nice folder, a nice packet, because all of those things, again, just like it shows a pretty beautiful picture of you to the doctors, it also will show it to Social Security. Now, when we think about Alzheimer's, we talked about things that can contribute, be it your medical issues, be it the things that you've experienced in your life, things that you're exposed to. So then there's always is Alzheimer's genetic. So family history is not necessary for an individual to develop Alzheimer's. However, our research shows that those who have a parent or sibling living with Alzheimer's are more likely to develop the disease than those who do not have a first degree relative with Alzheimer's. Those who have more than one first degree relative with Alzheimer's are at even higher risk. When diseases like Alzheimer's and other dementias tend to run in families, either genetics, inherited factors, or modifiable factors such as sleep, smoking habits, hypertension, and diabetes can further increase risk. Doing research for this program, I ran upon a study that they're doing actually in another country, but it involves a family of about 4,000 that they have looked at in this genetic pool of resources, and how does it affect not only dementia but other diseases. But it's interesting with that, if you look at that research, we don't have time to look at that today, how that family of about 4,000 and those genetics just dealing with dementia, how it actually plays out in a family. Understand the genes that we're talking about is the APO4 and the APO2, and usually we all have deterministic genes. All of us carry genes, but then we have risk genes that kind of contribute to more. So with Alzheimer's, if you have more of that APO4, if you have two of those, you're more supposedly, allegedly, more at risk to get Alzheimer's. And what they found out with early onset, the ones that have those two genes sometimes are the ones that are getting early onset. The people with only that one gene get the, as we tend to say, the more dominant Alzheimer's gene that we know about. Now, when we talk about, where I was going to go back into this real quick and make sure, if you have any questions, we can go back into the genetic part and also talk about that. I just wanted to get through the information, so at the end we can actually have a good discussion about any questions that you've already brought to the table. The very important piece with any type of dementias, with any type of healthcare, is your support. And you have wonderful resources in the area with Insight Memory Care. They celebrated 40 years last year. They have this wonderful book that I've actually read and looked through and give it and talk about it to people, caregiving at a glance. They have early onset support groups. They help people understand how to still be social. They train caregivers. It is a wonderful resource, and they will also connect you with other things in the community. The other thing I want to talk about is us with Alzheimer's. The one thing that we do is that we do a lot of stuff virtually. We do a lot of stuff in person. We have support groups. I'm just going to play this quick video. And what we're talking about here is that we want people to understand that they're not alone.
My name is Libby, and I am living with Alzheimer's disease.
I understand what you're going through, and I want you to know you're not alone.
This site helped connect me to valuable resources and answer many of the questions I had.
I wanted to know how others responded to their diagnosis.
I wanted to know, how do I live day to day?
I wanted to know, how should I plan for my future?
I wanted to know what to expect as the disease progresses.
I wanted to know what resources were available through the Alzheimer's Association.
Take your time.
Learn at your own pace.
And come back as often as you need to.
You are not alone.
You're not alone.
You are not alone.
My name is Libby, and like you, I am living with Alzheimer's disease.
So this is on our website. And the one thing I like about the particular thing about this presentation is that you're not alone. We talk about how, and I guess I've got a glitch, so I'm going to go back out and share again. We talk about how it is very hard for people to, as I say, process. Everybody processes at a different rate, a different speed. For healthcare providers, we kind of process at the fact that we know that something else is going to happen. We know that we need to get this taken care of as quickly as we can. And a lot of people don't process.
My name is Libby.
Sorry. A lot of people do not process like that. So with our website and with a lot of other supports such as Insight, we give the person the chance to be able to process in their own right, to be able to go into their information and say, I just need information on this. I just want help with this. I might want to see others and how they are living or what their family's response was. They may not want the full blown, this is what's happening with my brain or this is what this looks like. But I think it's very important that with those supports, you're able to pull it together from our standpoint on our website. It's a zip code based, so it helps you with community resources. It helps you to understand family and non-family support. And one thing I want to say about that, a lot of times, if you are in a group of friends or a church club or a community club, a lot of people say, yeah, if you need some help, I'll help you. And, oh, what do you? And a lot of times we're going, oh, we're okay. This is one situation that even if they're not family and they want to help you and they can provide some type of support, let them. Because a lot of times it's easier for that person to set the groceries on the porch, to go run and pick up the medicine. It's easier for them to maybe, if you're at work, you meet them at the doctor's appointment, they take the person to the doctor's appointment for you so you don't have to go all the way back home. We have to look at support not always being within our family. We have to understand, and this was said to me not a couple of months ago, own your emotions. Do not feel guilty for any of those emotions you're going through, because nobody sat down on a piece of paper and said, yep, I want to take care of somebody with Alzheimer's, or I want to take care of somebody with a traumatic brain injury, or somebody that has a stroke. So it's okay to be frustrated. It's okay to be upset. It's okay to be like, you're a different person for me. I want to fix, 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 fix. Right now, that's not high on your list, and I have to be okay with that. Um, some of my family issues, my mother has Parkinson's, and when she first got diagnosed, I was the epitome of the healthcare provider and the practitioner and the nurse, but I was not the daughter. And I had to fall back and kind of put guardrails around her to let her still be her, and me to step back in my place as a daughter, not as a provider. So we have to understand that those emotions are going to run throughout the course. We also need to make sure we understand legal advice for the future, be it estate planning, be it guardianship, being this is what I want done if. Those are all things that need to be done at the beginning. I always say that once you start living, from the time you're born before you die, you need to start tweaking and adjusting those legal plans and how your life looks. We do several conversations about the weight of paper, about what guardianship looks like, what trust look like. What does it mean to plan your estate? What happens if those things change? What you need to know for your supports. It's very important that you get that legal advice for the future and for your whole family and include everybody so everybody will know what's going on. Because sometimes in family dynamics, there'll be one person that's in charge of everything, but maybe John, Mike, and Billy want to help. But Mary said, nope, I'm not doing that. So Mary has this burden that she's internalizing because she can handle it all, but she knows that somebody said that I had to do it all without involving anybody else. Then the other thing also for your support staff, if you're a very technology-based driven person and the person that you're picking for your support staff is not, you need to make sure that you have paper and pen for that person or notes or a journal or printouts. And also in the reverse, if that person is a very techno person, very technically savvy, and you've printed out billions and reams and notebooks of paper, that might not be what they want. That might not be what they can handle. So you need to think about when those persons are supporting you, how are you giving them the information they need to support you? Also, your medical team. It's very important. One thing that we do at the Alzheimer's, we will provide lists of referrals for doctors that understand and doctors that will listen because sometimes your medical team can be part of the problem. Sometimes you need people that are actually there to support you and not to check a box. So it's very important that with your support team, you're also considering your medical team, your neurologist, your gerontologist, your nutritionist, your endocrinologist, your cardiologist. All of those people are talking and they're in the same my chart, this chart, everybody can see your spirituality, whether it's in nature, whether it's going to an actual temple, a mosque, or what have you, to please get in tune to your spirituality because that gives you a chance to kind of calm down and everything's just not at the forefront. Meditation, relaxation. I notice Insight has wonderful yoga classes. There are things that are out there that will help you kind of center yourself. If it's not just sitting outside on the porch, or my favorite thing to do sometimes is sit in the car if it's cold outside and I want to go outside, I sit in the car and maybe not even turn on the car, but just to listen to the quietness at night. And then the most important thing that sometimes as a family and as a support people, we forget to ask, what does the person that we're supporting want? Or what do they need while they're processing? Do they want us to be like, just leave me alone, don't talk to me? Give me a week, give me a day. Or I only need help with you making my appointments. I don't want you to take me to them. What do they want from us? Because our support, what Melissa's support looks like, and anybody else in this conversation is totally different. We all do not have the same idea of what support looks like for us. So it's very important before we even begin this team is that we're asking the person, what do you want or need? How do I help you? How do I really support you? Now, as we've talked about what early onset dementia is, how that looks, what ages, the genetics, the other underlying medical issues, your family, we need to talk about a compassionate allowance program. So the Social Security Administration has added early onset a younger onset Alzheimer's to the list of conditions under its Compassionate Allowance Program, giving those with disease expedited access to Social Security disability insurance and supplemental security income. So when you're looking at this, if you are still working, you need to look into your HR in regards to disability, FMLA, what type of other programs they have for people that have been employed. And it also depends on the size of the company and what type of medical insurances they have set up. But you need to look at that. That also includes your COBRA. If you decide to leave from the job and retire, do you have COBRA? Do you have long-term disability that qualifies? Now, all companies do not qualify younger onset Alzheimer's under their coverages of long-term disability or what have you. So you need to look at within your employment, those disability allowances, short-term, long-term, FMLA, COBRA and all of that, and what is available to you. Then when you figure that out, if you're going to stay, if you still can work part-time, you don't want to do that, then you would look into this compassionate allowance program. Now with
Sharon,
any, yes.
sorry, I mean to interrupt. I just wanted to clarify. This also applies for frontal temporal lobe and Lewy body as well,
Yeah,
correct?
we're about to
Okay.
go into it.
Oh, great. Thank you.
No problem. So this was done just for that, but it does also qualify for other 88 different conditions that qualify for expedited consideration under the Compassionate Allowance Program. Applicants who have disabilities that fall under the Compassionate Allowance Guidelines can receive an approval for Social Security benefits in just a few weeks rather than having to wait months or even years. And currently, when I called and we talked, Social Security, they're about a good half a year behind right now. Before benefits can begin. And early onset Alzheimer's disease is one of the disabling conditions that qualifies for processing under the SSA's compassionate care allowance. And as she was saying, that they're also, we're going to come back out of this. There are also others that qualified. I just want to make sure that that was on the next one, and it is. So the others that are considered cognitive, compassionate care, cognitive diagnosis, ALS, Parkinsonian's, dementia complex, Creutzfeldt-Jacobs, early onset, as we talked about, frontal temporal, Lewy body, primary progressive aphasia, juvenile onset Huntington's disease. And those are kind of their cognitive disorders. We're going to go into another area that they have split up now. At least 200,000 individuals have been reported as having early onset Alzheimer's, while the condition has been known to develop between the ages of 30 and 40, most commonly seen in individuals that are at least 50 years of age. Many cases of early onset are linked to genetics, as we talked about before. Those who developed a condition at a younger age often have a family history of early onset Alzheimer's, and the majority of early onset Alzheimer's disease is linked to 3 specific genes. We talked about the APO4 and 2, and there's 3. So when we look at these different diagnoses, we also understand when you're filing for Social Security disability with early onset, you want to have as much medical documentation as possible with your disability claim. When they send out those forms to you, it will have a form to you. It will have forms for if you were still working your job, what you're doing within your job description, how many hours you're standing, you're doing this. They will ask you detailed information. It is very possible that if you are intending to do this and you are working, you sit down and either go out on the website and get a job description that is on your company's website of everything you do. And when they say everything, they mean from the time you come in that door till the time you leave. That is how detailed it is. How long are you standing? How long are you sitting? How many people you're in charge of, what you're doing throughout the day. That part with the job disability part, if you're doing that, it is very important that you literally think about if I'm picking up things that weigh 20 pounds, or if I'm pulling reports from 3 different states and merging them into a file document. It's very detailed. They will also send one to a family member or someone, a significant other, or somebody that has contact with you. They will send one to you. Now, that will include your medical information, your medications you're on, any adaptive devices, glasses included, medications that you're taking before and during, or you supplements that you've taken. You have to have all those documents and written statements from your doctor supporting your diagnosis. They will send one to your doctor if you are not able to take one to them. I always tell everybody to print off what they can from their MyChart or from their doctor to have it with your Social Security disability claim. Just because the person's application for disability benefits, it is on this compassionate care allowance, do not assume that it's going to be automatically approved by the Social Security Administration. Do not. It is not always the case. The point with, so I've done this with some clients, and what I will tell you, it's very frustrating because that paperwork, The amount of space they give you to answer some of this is not doable if it is a long, drawn out case. So what we had to do was get permission by his caseworker to be able to type and reference the number on the form. And each page has to have the form number and the person's case number on each individual page. It is a very long and tedious process. And sometimes, again, even doing this paperwork for individuals, it's very hard for them to go through and think and process this. So you might have to start and stop. But sometimes that's good. If you're not able to do it, it's better to get a services of qualified disability advocates or attorneys. Most community resources such as Insight, Alzheimer's Association can refer you to someone. The Social Security department does have someone that will help you also. We're going to talk about this at the end. I also want you to understand there's a new nuance called organic mental disorders. So organic mental disorders are also referred as chronic organic brain syndromes. They are the affliction of the brain that leads to severe mental or behavioral problems. They may be permanent or temporary and can be either hereditary or caused by injury, disease, or a structural or systematic defect in body chemistry or hormones. Organic mental disorders do not include disorders that result from substance abuse, nor do they include psychiatric disorders. So common symptoms of organic mental disorders could include confusion, memory loss, brain function, agitation, but symptoms can differ somewhat based on the condition and the amnesia. So underneath this wonderful organic mental disorder does fall again Alzheimer's. This is something I want to touch on. We can go back into it at the end. You want to understand if you're disabled because of an organic mental disorder so severe that it prevents employment, you may also be entitled to those SSDI benefits. How much they're going to pay is going to vary. And this is why it's important to work with a medical professional and qualified Social Security disability attorney at this point to advocate and collect and the appropriate materials, because with the organic mental disorder, there are other things you have to qualify for. And that working with someone that actually knows the list of, we're going to talk about a little bit, the list A and B that you qualify and C. So when you're filing for Social Security disability with diagnosis of organic, they consider that, and I've got references at the end of this, and I will send a copy of this to Miss Melissa, and their blue book covers mental illness disabilities. Cerebral trauma, traumatic brain injury, is found in section 11.18, and that defines organic mental disorders as a psychological or behavioral abnormality associated with a dysfunction of the brain, and requires that when you apply for the disability benefits, you submit records documenting the patient's medical history, including examinations or laboratory tests which demonstrate the presence of a specific organic factor judged to be the cause of the person's abnormal mental state and loss of mental function. The reason why I bring this up, because it does apply for Alzheimer's. The one thing I wanted to go back into and let you know is the reason why it does apply is that because it might have not been, and I've got to go back into my notes and I apologize. So when you're demonstrating that loss of those cognitive abilities, one of the following, you have to have disorientation with regard to time and place, shorter, intermittent, long-term memory impairment, perceptual thinking, hallucinations, delusions, changes in personalities, fluctuations, loss of measured intellectual ability of at least 15 IQ points. So this can also go with someone that has what we call intellectual delayed, and they have had a further downfall or decline. Those are the things that I wanted to talk about with that. We can go back into that, but I wanted to make sure that we talked about how we can also apply for that along with the early onset. because some of these things with the organic mental health may also be happening with that. Repeated episodes and worsening, current history of 1 or more years, inability to function outside a highly supportive living arrangement. So that is somebody that maybe has been living at home by themselves, but now all of a sudden cannot. They're not able to take care of themselves because they have had either some dementia, Alzheimer's disease, amnesia, delirium. So those are things that we can kind of look at. We have to think about also when we're talking about those types of capabilities and being able to help people, we want to understand that you can get help with that compassion allowance claim. You can actually go to I've put links here and I will cut and paste them and put them in the chat box at the end, that you can actually go in on the website. We're going to take a minute and look at this website also, and it will show you, and it's a little short form that you can fill out. And let me stop sharing, and then we're going to go to the website that I have pulled up for you guys. Let's see. So here is the website. So let me go back and pull y'all guys to it. No, not that one. Sorry. Here's the website. So for compassionate care allowances, they have links. They talk about the list of compassionate care allowance conditions. It also has it in a PDF. So if it's not one that you actually see here, I went through this list and pulled out the ones that were pertinent to dementia and Alzheimer's, but you can also certainly go through and pull out others. Kidney cancer, mitral valve atresia, mixed dementias, of course, carcinomas, different carcinomas. So you can go back and look through all of these, and I'm going to put links in the chat box so you can look through this also. But this is a way for you to go on that website, ssa.gov, compassion allowances. And so they will submit the name of condition if there's not one listed for consideration. But so this list is changing as we speak, because you're able to list different ones that you want to perhaps have on there. And let me see if I can go back to, let me stop sharing real quick. So that is the actual website for that. The other thing I wanted you to see is when we talked about cognition and we talked about the state of Virginia and the cognitive decline in Virginia, I wanted to show that form to you. But this is cognitive decline in the state of Virginia. And this was done back in 2022. So this data is somewhat old, but 10% of those age 45 and older report they're experiencing confusion or memory loss. And that is happening more often and getting worse. And there's the problem with not talking to their healthcare provider. And so that's why I say it's so wonderful that places like Insight and Alzheimer's and your senior centers and have tangible, evidence-based information that you can click on, that maybe once you feel a little bit better and comfortable about what's going on, then you can go in and talk to a doctor. Percent of people that with memory problems that live alone, 20% of the Virginia population. Then you look up gay persons with memory problems that created difficulties, people that gave up day-to-day activities, 34%. People that needed assistance with day-to-day activities is 27.2. So, and a percent with memory problems who have at least one other chronic condition, that is 85%. So when you think about early onset, you can have early onset because The oxygen has been depleted to your brain or the blood. That is also involving your cardiac system, your breathing. So it also could be affected if you've worked in a factory for an extended amount of time, and the access to fresh air and where you've lived. So there's a lot of things when you look at things dealing with other chronic conditions, diabetes, high cholesterol. We have to look at all of those things in that total picture when we're talking about early onset. And on our website, we have also how you can click, and again, the ease of click and knowing how to apply for your benefits, tips when seeking employee benefits, how to go about keeping that information. Again, the Family Medical Leave Act, always ask for that in writing so you will know the Affordable Care Act. You have to know all those things in your retirement benefits. What happens if now that you have this and you're before that actual date? Is there any documentation within that retirement benefits that say if I get a actual Social Security defined disability before then, am I still able to pull out my retirement? We have to also understand that there's a way that you can involve yourself with research, and this is a LEADS study, which is a longitudinal early onset disease. And they start looking at genetic and biologicals. We have free online workshops, living with younger onset, helping families talk to their children about that, what that looks like for them. We want to make sure that everybody is kind of encompassed in that care. And so I'm going to stop talking now. And if y'all have any questions, I'll be glad to answer them.
Go ahead, put your questions in the chat box so that I can read them. That was very, very helpful. Thank you very much, Sharon, for that.
Yes, and like I said, it's a lot of information. If you have further questions, I'll be glad to go in depth with it. Because the one thing I will say, and Melissa knows this about me, this is something I've experienced very up close and personal. It's not fun. It is very frustrating, especially when you're doing this and helping people. I've actually spent 90 some dollars just faxing information to Social Security for this because I mailed it once, they didn't receive it, and I kept a copy by the grace of God, and then I faxed another copy, and we're hoping they got that. But the one thing that amazes me is that when you fax it, even to that direct person, that all of that does not go to that person. You have to make sure, and it's amazing to me that all that is so important, but it seems like they have no way of tracking it.
Yeah, it's amazing. It's like the VA. Keep lots of copies. I see someone keeps raising their hand. We're not doing talking, but if you put your question in the Q&A, we can answer it that way. Sharon, is there any programs that help with the cost for a Social Security lawyer if you have to get one?
So what I have been told and what they told me is that they have people at the Social Security Disability Office that will help people and walk them through it. Okay. There are also people that are with DARS that can help you fill out the information. And we at Alzheimer's will help you get the information together. I will personally do it case by case. I've helped some people in Fredericksburg with that and with the court systems and things. The biggest thing I will tell anybody is that you have to keep your paperwork together. Somehow, if it's in a folder, if it's in a box, it needs to be together because they will ask you for that.
Gotcha. All right. Yes, please use Q&A. Thank you for those that have gotten in here. So our first question, did I understand correctly that even if someone qualifies for the compassionate approval, aimed at being in place in a matter of weeks to them, that it will currently take half a year or longer due to the backlog?
Yes. So I will say the system is broken. I will say that they are having somewhat of a backlog on all Social Security disability claims. Some people, so my point, so here I'm going to tell you my personal view. I think people that have quick to the point disability claims, say, I'm depressed, I can't work, or yada yada. I think it's more clear cut when you have someone that has a lot of issues going on, say maybe a pacemaker, they have early onset, they've got cardiomyopathy, they've got all these things going on at once. So they have to pull all this information from all these doctors. And like I keep telling everybody, and a lot of my clients look at me like I'm crazy, but unless you're bugging them, they're not going to fill out the stuff in a timely manner.
Yeah.
So I always say bug them, take it to the office if you can yourself, call and check, get a name, because there's a lot of times that paperwork will go to an office, it'll sit on a nurse's desk, and it will never get filed out. The doctor will ask, well, what am I supposed to be doing? I don't know. That's been since a month ago. So they will file it away in your chart, and it will never get done, and it will never get sent back. So yes, it is designed that it's quicker than most, but when I checked with them last year, maybe about Thanksgiving or so, they were still running about 3 to 6 months behind.
Thank you for
But
that.
the thing about that is, though, they still work on the initial date that you applied. So if you applied in June of 2024, you should get the money from that till that point. Even if you use a Social Security disability attorney, they cap their fees at like 6,000. So it could be, if you get a windfall, they can only get 6,000 of that. And I think most ones outside of Social Security, which I say the ones that are in the community, they only take a percentage. But I would always go look the free route first, the disability lawyers and attorneys that will do that, DARs, things of that nature, your community. A lot of legal aid will do things for older adults. Libraries have resources for older adults that need attorneys, things of that nature.
There's some great legal aid clinics through a couple of the universities too. You
Yes.
can share if anyone needs them as well. Helen was curious what information you'll be sending out. So Helen, when she does the information, she's going to send it to me, and I'm going to have it with this webinar on our website. And we may turn it into a blog as well to make it helpful. But Sharon, what are you looking to pass on from today?
So I have links for all of the Social Security. I have links, of course, for Alzheimer's. I have put ones in there for Insight Memory Care. Helen, are you looking for something in particular in regards to information? And I as I tell Melissa, I go down rabbit holes and then I kind of put stuff in folders. So what I need,
I think what might be helpful is maybe a step guide, like what they need to do in order, and then all the links. I think that would probably just really simplify it, because we know when we get on those web pages, they get over confusing.
Yes. No problem.
Does anybody else have any questions? I know it's a lot of information. We're going to get it out to you. This is recorded. You can always rewatch it as well. We know this is not an easy journey with this early stage diagnosis. And so we want to help with it as much as we can with that as well. So.
And then if you would need information about, somebody else had their hand up. If you needed any other, that might be Helen's, I don't know, maybe we didn't put that one back down.
Mm-hmm.
If you need any other questions or caregiver support, or like I said, just a rant and rave, because it's very okay to be upset. Yeah. It's very okay. It's very okay.
Yeah, absolutely. Well, I don't see any more questions. So I want to thank you all for being here. You can always reach out to me afterwards, and I can reach out to Sharon and if I can't answer the question. But please look out for our upcoming events here in 2025. You can go to insightmcc.org/events for that. Oh.
Yes.
And look, next month we have a unique talk that's coming. We have a great group coming to talk to us about gun safety. Not something I thought we'd be talking about, but I actually quite a few people last year asked me, what do you do when you get this diagnosis? Because we are in a state where we can carry. So we're going to have a good discussion on that next month about what to do with that. So I'm excited about that new topic to come up. But keep an eye on our calendar for all the things coming up. We also have a boot camp in January at the end of the month as well. And we would love to have you guys sign up to any of those. But thank you again for coming on our third snow day at Insight. And this will be recorded and we'll get all the information out to you guys as well. And again, thank you, Sharon. And I hope everyone has a wonderful rest of your week.
Thank you. Thank you for having me.
Absolutely.